PH with Tabitha Ponte. On this episode 1, welcome Robert Sundelius.
Robert Sundelius, thank you for coming into our first episode. I'm so excited.
My
Um,
pleasure. Thank you.
yes, first because we seem to be very aligned into how we think about health and where health is going. Um, Let me first ask you, where did you come from? Tell people a little bit about who you are, and then we'll jump right in.
Certainly. 20 plus years in the health industry sector, primarily at the C-suite. So chief administrative, chief operating, and chief executive officer. I had 10 years in that journey consulting nationally with some global consulting. And I've worked for varied business models in the health industry sector. Founder startup, middle market, the largest health systems in the United States. Coming out of my full-time executive roles, I had an opportunity to step back, Tabitha, and think about the fruit that is being left by our medical care systems and how they're growing. And I realized that though we're investing billions, we have more heart disease, more diabetes, more obesity, more mental health issues.
Yes.
And at that point in my career, I made a complete pivot, and I've been doing something extraordinarily different from that point forward.
Yeah, I feel you, and I feel like I did the same. So that hence this is why we're so aligned with the with everything. It's I also feel that we're spending more but doing less and accomplishing less, and it just I think it has a lot to do with a lot of different factors, and we're gonna get to that into that a little bit. But again, thank you for joining us. And first and foremost, how about that RFK Jr. and make America healthy again? What do you think? Is it a yay or a nay for you?
Well, let's say it this way. Whatever response I'm going to make right now is outside a political party, because political parties come and go.
Yes, correct.
However, the commitment to make America healthy again, I absolutely resonate with.
Yes.
The wealth and security of a nation is the health of its people. And we in the United States are moving in all the wrong directions.
I totally agree with you. And I think regardless of anything, I do feel that he has really great intention and comes from an honest place, especially with our children becoming healthier, which is something that also bothers me very much. So politics aside, it's just something so recent I had to touch upon, as you know. You spoke about health literacy. That was less than 10 days ago. I saw you post something, and I wanted to discuss that briefly. Health literacy in this country. I mean, we could speak globally, but I'd rather kind of stay within the scope of the United States of America. What do you think about health literacy and where we are as a nation? And what is the problem?
Yeah, it's an interesting question. You look statistically at the research, and 88% of adults in the United States say they have no health literacy or subpar health literacy, which means very practically, we don't know what it means to be healthy. You add to that, I don't know who to listen to on my journey to better or my journey to health. And if you think about protected health information, Tabitha, the platforms in which the most health information is shared is TikTok, it's Instagram, it's
the
Facebook.
public facing, right?
It's community looking to community to say what's working for you, what's not working. And I take a work back plan. So when I think about health literacy, and if people truly understand health, we should be seeing a change in the trend lines of chronic disease, a change in the trend lines of mental health issues. And we're not. And it's because we are living in a society where we do not have a system for the care of health in an easily understood way where I live each day, where I work and sleep and play and learn and shop. I have no system to help me connect the disconnected and make visible the invisible on my journey to better. Yet,
Correct.
That's the system.
I feel that there's a lot of sort of the spread of fear, the spread of stress among people. It seems to be far more powerful fear than hope or positive feedback. Even in when it comes to people's health, I feel that there's a lot of gathering of sort of the negative, and even though people want to be hopeful about being healthy, they don't know where to go. It's and you're right, it's the public platforms, but that comes down to the voice of people, right? And then if people are subpar, let's say in health literacy, then that is what's sort of moving through the masses. I find that in to be honest, this is why I started PH with Tabitha Ponte, right? It's about public health. And what I wanted to do is sort of touch upon vox populi of health and wellness and getting better, which is not our healthcare system today, right? It's not pharma, and it's not chronic condition. I have done a lot of very interesting research in developing the projects that we work on, that has led to a lot of very interesting recognition of why we're chronically ill. I mean, I think the primary reason really is food and what we intake, right? So that's reason number one. Yes, people need to exercise, but I think all of the secret is in food. And I feel that's where hopefully we're going to work to make change, but it starts at home, right? The changes that you need to make at home. Now, if everybody's subpar health literate or deficient, how do we fix that? What do you think has to happen, let's say en masse, for fixing the issue?
Right. It starts with an N of one. So a first name and a personal story. And it's that system at scale. So if healthcare doesn't work for me, it doesn't work. So if it doesn't work in my daily micro choices over longer rhythms of time, it doesn't work, which means that the pillars of health are all connected, Tabitha. So you mentioned eating well, very significant pillar of health. We also have daily movement. We have sleep, we have social connection, we have mental well-being, and we have self-care. We don't connect those because it's not a simplified system in a language that I can understand that creates continuous health engagement in my unique environment. And that's what needs to happen. For us, it's 4 foundation stones. The first is literacy, which means helping me understand what it means to be healthy where I'm at. And that's different for a young girl in a wheelchair on a farm than a single mom in Detroit with 2 kids, than an Olympic athlete, or someone who's on a Native American reservation in the Southwest of the United States. But they all have a different journey to health, and helping them understand what that means is literacy. The second foundation is agency, which means I'm the CEO of my own health. Yes. I'm the most important person. Then there's resource and incentive, which is how am I encouraged to take those daily micro choices in the right direction? And then there's social community, connection, trusted and supportive community. If we address those 4 foundation stones and build on them the pillars of health, we're starting to move in the right direction at scale.
Great, and I agree. And when you say us, who do you speak of? Our pillars, when you speak of our pillars, explain what you're talking about.
Yeah, so us, general society, but we have developed a public benefit corporation called the Human Flourishing Collaborative. It is transparent and accountable to the public. Our commitment is to orchestrate science and technology, entrepreneurship and investment for one sole purpose, and that's toward human flourishing. We're starting with an anchor platform that will be direct to consumer. So instead of treating injury, illness, and disease, our sole objective is keeping people from becoming patients. And it's doing that where the seeds of illness and disease are planted. And that's where we live every day.
Yes.
It's where I go to work. It's where I shop. It's the building I live in. It's the stuff I put in my mouth. It's how I interact with technology. It's my isolation or social community connection. All of those are critical. So we're going to take something that's very complex and we're going to make it easily understood to the populace of society, the 90% of people who don't own an Oura Ring or pay $500 a year for Function Health, and make it easily accessible in something they interact with every day.
Now, let me ask you a question, and it's kind of like playing devil's advocate, right? In the best case scenario, this works exceedingly well. What do you think happens with the healthcare system we know today and all of their power, their capital power, their interests, pharma, insurance companies? What happens with them if our future is about not becoming patients?
You know, I absolutely love that question. And the way I think about this, so our medical care systems and everything associated with that is necessary for a just and equitable society. So if I have a brain aneurysm, I want the best healthcare I can access. If I need a hip replacement, I want that. Yeah. So that's necessary, but Tabitha, it's not sufficient.
Yes.
We have one system.
Agreed.
We need two. We don't have the system for the care of health. So we expect that chronic disease will be reduced by 3%, 5%, 7%, 10%, eventually more, which will reduce the tsunami burden on our current medical care system, will allow us to pivot over time from reactive medical care to proactive care of health, will diminish our burden on pharmaceuticals, on treatment protocols. And I use this example. So I'll speak about the dark side. Philip Morris International, they make cigarettes, right? And they kill millions of people a year. They have publicly said they are committed to changing their entire global business model to create no harm products. If you go to their website and look at it, they've put a stake in the ground. They have a date. And they are saying, we know we do this now, but we are committed to doing it differently globally by this date. Hold us accountable. If we can begin those conversations with pharma and say, yes, treatment is critical, let's also focus on avoiding the diseases that you're currently treating. And let's do that over X period of time and shift your business model. And then we do that across a number of industry sectors. We end up where my daughter, my granddaughter, and my great-grandchildren wake up in a society with less chronic disease and less social burden.
And I love that. I love that about your mission and your group's mission. I love that about, our deals in my company and everybody that I speak to that really is sort of aligned to this end. We're few, but I do think this is the future. I think the future is about not being so tied to the management of illness, right? So this kind of completes our 15 minutes. But before we go, the last thing I want you to do is I want you to share with our audience a special quick tip or habit of yours to be healthier, or of somebody you know really close that you've seen work. What would that be? What could they try?
Make it simple. Think of a daily micro choice that you can take and just make it simple and do it. We build micro decisions on top of one another. We make it too complex. We think we have to spend a lot of money, access a lot of information. We don't. Take a walk, drink more water, make it simple.
Water with lemon. I tell people lemon.
Right.
Lemon is a thing, right? But
right.
Thank you so much, and thank you for your time. This was our 15 minutes. I think it was rich, and people are going to love it. And I commend you and your group for everything you're doing, and I very much look forward to that. And there's this book I wanted to share with you just in case you were interested. It's called The Future of Nutrition. If you have not read it, by Colin Campbell. And it's about a 4-year-old book. It is fabulous. Is in the whole foods plant-based future that we should consider. And with that, thank you, sir. Have a great afternoon, and we'll see you soon.
Thank you so much. Bye-bye.
Share and subscribe now. During this first episode, I spoke of The Future of Nutrition by Colin Campbell. Check it out. The link is there.